Hello everyone, respected Professor Lang Xiaoming and fellow classmates. On behalf of my group, I would like to express our gratitude for the opportunity to present. First, let me introduce myself. My name is Azzara Amelia Hafidha. I will be delivering our group presentation on the Internet of Things or IoT in pharmacy. Before we begin, I would like to introduce the member of our group. These are the names of our team members. Okay, the IoT is based on physical device connected to the internet. This device can collect, analyze, and send data. By using sensors and communication technologies, they allow data exchange to happen smoothly. In the healthcare field, IoT plays a major role. It connects medical equipment and sensors that sense data, which is then interpreted by artificial intelligence or healthcare professionals. Next, let's take a closer look at how digital health and IoT are shaping the pharmacy sector. Digital health has undergone significant expansion, driving transformation across healthcare and influencing numerous medical professions. In the pharmaceutical industry, the Internet of Things introduced sophisticated and forward-thinking solutions. These range from digital inventory systems to real-time patient monitoring technologies. By merging physical workflows with automated digital systems, IoT dramatically reduces manual workload, improve operational efficiency, and minimize human error. For instance, instead of manually tracking medication supplies, IoT sensor can automate this process, allowing pharmacists to shift their focus to more critical roles such as patient counseling and care. This integration not only increases safety and accuracy, but also elevates the overall quality of pharmaceutical service. Okay, next, let's move into the history and current application of IoT in pharmacy. The pharmaceutical industry began adopting Internet of Things or IoT technologies for the first time during the mid 2010s. Since the late 2010s, the focus has shifted toward patient-centered application. This includes tools for health and medication monitoring, enhancing the overall patient experience and improving healthcare service delivery. Okay, the current application of IoT in pharmacy is intelligent inventory control system, automated monitoring of temperature and humidity, system for tracking patient medication and sending reminders, improving the quality of patient interaction and satisfaction, ensuring transparency and traceability across the pharmaceutical supply chains.
Application. Some notable application of IoT in pharmacy. There is first smart medication dispensers that remind patients to take their medication and notify healthcare providers if those are missed. The second, real-time temperature monitoring system for vaccine storage and transportation, ensuring compliance with cold chain requirements. Third, automated inventory management systems in pharmacies and hospitals, which monitor stock levels and generate alerts for restocking. Fourth, IoT-based drug tracking systems that monitor the location and condition of pharmaceutical products throughout the supply chain. In this presentation, we will focus on two case studies. First, IoT in vaccine cold chain management and wearable biosensors for medication adherence. First, Internet of Things or IoT enable framework for a sustainable vaccine cold chain management system. The study shows how IoT can monitor vaccine temperature and transport in real time, especially useful in remote areas. It improves safety, reduces wastage, and helps during crises like COVID-19. The implementation of this concept through a product called Cold Trace 5. Cold Trace 5 by Nextleaf is a real-world tool that tracks vaccine storage temperature. It sends alerts when temperatures go outside safe limits and is already used in over 20,000 health facilities globally. Next, our second case study looks at how wearable tech can improve medication adherence. By MedSensor, medication adherence monitoring using neural networks on smartwatch accelerometer data. MedSensor use smartwatch data and AI to detect if a patient has taken their medicine. It helps track medication adherence non-invasively and supports better treatment outcomes. Then, their product like CarePredict is a wearable is a wearable that tracks movement, reminds users to take medicine, and alerts caregivers if unusual behavior is detected. It's mainly used for elderly care.
You have to know about the benefits, limitation, and ethical issue of IoT in pharmacy. The first is benefit of IoT in pharmacy. We have improved medication management, real-time monitoring, supply chain optimization, data-driven insight, and the last is enhanced patient safety. And we move on to the limitation. The first is high initial cost. Implementation and maintenance of IoT system can be expensive for small or rural pharmacies. The second is complex integration. Difficulties in integrating of IoT devices with existing electronic health records and pharmacy system. Third, technical failures. Device malfunction or connectivity issues could be lead to doses, fall alerts, and data loss. Fourth, data overload. Managing and interpreting vast amounts of data can overwhelm privacy staff without adequate tools or training. The fifth and the last, scalability issues. Scaling IoT solutions across multiple pharmacies or regions can be technically challenging and research intensive. And the last, we want to talk about the ethical issues in IoT in pharmacy. The first is privacy data security. Patient health data is sensitive. IoT devices collecting real-time data may be vulnerable to hacking, breaches, or misuse. Who owns the data? Patient, providers, or device manufacturers? The second is informed consent. Patients must fully understand how their data will be collected, used, and shared, which can be difficult with complex IoT ecosystem. Third, bias and inequality. IoT solution may not be equitably accessible, leading to health disparities among underserved or elderly population. Fourth, autonomy versus automation. Over-reliance on automated systems may reduce pharmacists' clinical judgment or patient autonomy in decision making. The last is accountability. In the case of a device failure on or incorrect recommendation, it's unclear whether the device maker, pharmacist, or software provider is responsible. And now we talk about the process. First is identify your objective and set clear target. The second is the breakdown the tasks and allocate resources effectively. And the last is implementing. Wait, implement the plan, monitor progress, and refine as needed.
Okay, I'm Nadia Zahra Rose. So, IoT has transformed healthcare by connecting devices to the internet, making data collection and sharing easier. In pharmacies, it helps with smart inventory, automates patient monitoring, and real time temperature tracking, reducing errors and improving efficiency. Since the mid 2010s, the focus has shifted to patient centered solutions, enhancing care quality. Examples like cold trace for vaccine management and MedSensor for tracking medication use show how IoT improves safety and health outcomes, shaping the future of healthcare. And this is our recommendation for the future of IoT in pharmacy. is smart inventory management, enhanced supply chain transparency, remote patient monitoring, predictive maintenance in manufacturing, personalized patient experience. And this is our references. Okay, that's our presentations. Thank you for your attentions.